Today I am going to discuss about spinal cord blood supply. Most of the time, people have very less understanding about the spinal cord blood supply. If you have infarction in your brain, you can become paralyzed. If you have spinal cord infarction, again you can become paralyzed. The final appearance is same, but you have very little amount of understanding about the spinal cord blood supply. More understanding about the cerebral blood supply. So you should have very good knowledge about the spinal cord blood supply. Your spinal cord right now going to supply by 3 major arteries. 2 posterior spinal arteries and 1 anterior spinal arteries. This is my spinal cord, this is anterior side, this is going to be posterior side. My spinal cord artery is going to arise from my posterior circulation of brain. Posterior circulation of brain going to produce by vertebral artery. If you look at my anatomical position right now, my vertebral arteries travel through transverse process and going to enter into brain. This is my 2 vertebral artery. Travel through my transverse process. After that, it going to union into together and going to produce basilar artery. This one is vertebral artery. This one is vertebral artery. This one going to be left vertebral artery. This one going to be right vertebral artery. Sorry, I am wrong. This one going to be right vertebral artery. This one going to be left vertebral artery. Right, left. Before it going to produce basilar artery. Before it going to produce basilar artery, it will use 2 small branch. Those 2 small branch going to union together and going to produce anterior spinal artery. Anterior spinal artery. It come into this area. It's down to your spinal cord through your this area, anterior part of the spinal cord. This anterior spinal artery going to supply this anterior 2/3 of your spinal cord. Your anterior 2/3 of spinal cord, vast majority of your spinal cord going to supply by your anterior spinal artery. Anterior spinal artery going to produce by your 2 vertebral artery. This is your vertebral artery. From those 2 vertebral artery, your anterior spinal artery going to produce. It going to produce anterior spinal artery here as well. Anterior to central canal, anterior part of the spinal cord, through your arachnoid matter. Here your posterior inferior cerebral artery. Here again your posterior inferior cerebral artery, commonly called PICA. Here your posterior superior cerebral artery. Posterior superior cerebral artery. From your posterior inferior cerebral artery, they going to produce posterior spinal artery. Anterior spinal artery will be here. Posterior spinal artery will be here. You have 2 posterior spinal arteries. It going to supply your posterior 1/3 of your spinal cord. Not only that, they are going to reconnect together. And produce circular network. They have very good horizontal connection, very poor vertical connection. Very good horizontal connection by those network, very poor vertical connection. Believe me, those arteries are very small. Can you supply from here to here by using those arteries? No, it is very difficult. It is very difficult to supply whole spinal cord by those very small arteries. Because of that, nature created us in very fascinating manner. What they did is, from your aorta, they are going to give several branches to improve their blood supply as a collateral. From your aorta, they give several branches in order to improve your this spinal circulation, spinal blood flow circulation. Those arteries enter into your spinal cord via your anterior root area and the posterior root area from both sides. Those arteries can enter into your spinal cord. These arteries can enter via posterior and enter via anterior. This one also can enter via posterior part and anterior part. Not only aorta, vertebral artery also. This is your vertebral artery. From vertebral artery also, they can give collateral into your spinal cord. They can give collateral into your spinal cord. Called vertebral artery, radicular vertebral artery. Radicular vertebral artery. From cervical area, cervical radicular artery. Vertebral radicular artery going to supply your spinal cord. Cervical radicular artery going to supply your spinal cord. Thoracic radicular artery also going to supply your spinal cord. Roughly 25 to 30 branch of this radicular artery going to nourish your spinal cord blood supply. Going to nourish your blood supply. Out of those arteries, from T10 to T11 area mainly contain one of the major artery, large artery which going to nourish spinal cord. This artery called cervical radicular artery, thoracic radicular artery, lumbar radicular artery. This one is largest artery. Again is kind of radicular artery, but is magnified artery. Arteries radicularis magna. The name of that one is arteries radicularis magna. The largest artery which going to supply your spinal cord usually at the level of T10 to T11. Usually at the level of T10 to T11. Arteries radicularis magna, or arteries of Adams Kivkis. I don't know how to write it. The person who discovered that one is Adams Kivkis artery. I don't know how to pronounce. I don't know how to write. So commonly called arteries radicularis magna. They have to donate whole mark if you write that. So 25 to 30 of those branches going to supply into your spinal cord. Additionally, in addition to posterior spinal arteries and two posterior spinal arteries and one anterior spinal artery, they are going to nourish by those arteries. Sometimes, due to unfortunate situation, this arteries radicularis magna going to arise at the level of T5, going to rise at the very high level. This one going to supply large majority of blood in lower part of your spinal cord. If it is arise very early, lower part can be chronically insufficiency of your blood supply. Lower part chronically insufficiency. Sometimes you can develop some various kind of neuropathy in the lower part of spinal cord due to inadequacy of blood supply. Why this artery appear too early? Ideally it should appear at the T10 and T11 level. This artery has major clinical significance. When you are doing abdominal aortic aneurysm repair, or thoracic aneurysm repair, you have to preserve this artery. If you block this artery, your spinal cord infarction can happen. Due to some reason, if your anterior spinal artery going to be blocked. If your anterior spinal artery blocked, your anterior 2/3 of function, spinal cord function going to lose at the same level. Pain and temperature. You don't feel pain and temperature below the level of lesion. Motor function. all the motor function, all the sensory function, not all the sensory function, pain and temperature sensory function and the motor function going to loss. But your posterior part is preserved. So the signal carried by your posterior column going to be preserved. What are the signals? Light touch, vibration, proprioception, light touch, gravisthesia, stereognosis, 2-point discrimination, all are carried by your posterior column. Those are preserved. If your posterior column goes, this one going to be lost, your motor function, pain and temperature going to be preserved. If you found a patient with motor function loss below the T10 and pain and temperature function loss below the T10 but preserved light touch, vibration, proprioception, 2-point discrimination, gravisthesia, your spinal cord goes below the level of T10 at the level of T10. Thank you very much. That is all regarding the spinal cord arterial blood supply.